Good evening, everybody, and welcome to this phenomenal webinar tonight. I am personally so excited. So let's jump into it. We just want to let you know that none of this can be taken as medical advice, and we always want you to consult your doctor with any questions or treatment. This webinar is set to be super interactive. We are going to have polls during to take your opinions and see what you think and feel. So we want you to share your feelings with us. Don't hold anything back. I now have and you can also ask questions anytime during the webinar. We will have Carly and Kim and Dr. Strober on to answer your questions. There is a questions pane in the right-hand panel. Please ask them anytime. Now, I have the wonderful privilege of introducing our main speaker tonight, Dr. Lauren Strober, who is so accomplished, so amazing. I've spent every day with her this week, and she's just an incredible human. So, Dr. Strober, take it away for us.
All right. Well, welcome everybody, and hopefully this will be educational and enjoyable, and like we said, Lexa was saying, interactive, which can keep everybody awake. So let me just get Tonka up here. And, I'll introduce a little bit more about my research. Actually focuses on, so I'm a clinical neuropsychologist and clinical psychologist by training, but I do primarily research for the past, almost 2 decades, so more than 2 decades. And I used to study factors associated with MS, such as depression, fatigue, sleep, and then over time realize, it's not as fun to investigate all the sort of negative things that happen with MS, that you find so many people who are living really well and actually maybe even better in certain ways since their MS diagnosis. And so I've been really spending a lot more of my research and effort honing in on what are those factors, like how do people manage to live well despite their MS, or manage it more effectively so that it is not as intrusive. So that's what I do now. I do a lot more sort of positive psychology and a lot more clinical intervention research on how to apply those, what we know about those factors, and applying that to creating interventions to help people. So tonight what I will be talking about is the bumpy road of MS, adjusting to your new normal and maintaining health and well-being. With that being said, this is sort of a quick overview of what I'd like to get to tonight. So we will talk first about sort of the shock and awe. How do people respond initially to a diagnosis of MS, and the many reactions or phases that can come with that. And in particular, we'll look at stages of grief. So many are probably familiar with Kubler-Ross stages of grief, which is usually was developed actually for mourning, but has been applied to many chronic illnesses because there is a sense of mourning typically associated with that. Then we will do an overview of what are the factors that seem to contribute to adjusting to MS or having a better adjustment. And we'll be looking at a large meta-analysis in which they've looked at, I think, 72 studies that have looked at adjustment, and they synthesize this all very nicely into about 8 domains. And we will be able to look at that and have a nice synopsis of that. Again, I mentioned I studied a lot about depression and anxiety in MS. We will talk briefly about that. I didn't want to get too much into it. I think everything else is a little more interesting. And then your best self. So, how to flourish, how to live well despite your MS, and we'll get to some of the positive psychology principles related to that. So let's first talk about the shock and awe in response to an MS diagnosis. So, common initial reactions for people are things such as, sort of this confusion or despair or shock, and really in many ways a lack of a knowledge about MS. So people might say things such as, will I be in a wheelchair? Am I going to die from MS? Am I going to go blind? What does this mean for my family? What does it mean for my work? Especially since many people are diagnosed with MS in the prime of their lives, where, this really puts a very, strong pivot on developing a family, establishing your career. So it's also it's not just a diagnosis of MS, but the timing of it and all the life transitions that many people are going through at that time really can lead to this sort of big shock and awe of a diagnosis at that time. Am I going to be totally dependent on others, especially at that age? It can also be seen as an emotional trauma, and many times an emotional trauma can lead to a state of denial. And fear, and again, the fear is, I think as people come to educate themselves and become more knowledgeable about their MS, it's not as fearful. And so, but in the beginning, certainly due to the uncertainty and the variability of the illness, there's a natural fear and anxiety just inherent, I think, to having a diagnosis like MS. And, on the flip side, some people say it's a relief. They finally, found a doctor that gave them a diagnosis to what they were experiencing, and this feeling of, I'm not crazy, or that, it wasn't nothing, or, I finally, all these things I've been experiencing or feeling that were pretty vague now have a name and I can actually tackle it. So it's kind of a, inverse reaction to what you would think. So related to this, so there was a 2014 meta-analysis where they basically looked at, oh, sorry, this is not the meta-analysis. This is just one of them. There is another meta-analysis I did not report. But this was one of the papers that came from that meta-analysis that I really liked. They interviewed 25 people, kind of in focus groups, and asked them about their diagnosis to MS. And through that, they identified 4 themes. One is this sense of a knowledge deficit. As I mentioned, that's what kind of leads to a lot of anxiety and fear early on. Another factor was concealing the disease. And I've run into this myself with some patients. It sort of was a surprising finding for me. Certainly a host of emotional reactions. And the 4th theme was about religiosity among these 25 individuals. So we're just going to take a look at each of these and talk about how this may affect many of you later on. We'll have a discussion and like to get your input if this is something you experienced, and we'll ask some questions about that. But the knowledge deficit was that most patients were completely unfamiliar with MS, and this tends to lead to a large amount of information seeking. When I found out that I had MS, I didn't know it at all. I bought and read some books about MS. I attended MS societies, meetings, and seminars. I also searched on the internet. So these are all individual quotes that they use for the themes that I'm presenting as well. Another is that many people had false perceptions about MS, especially related to, again, if you don't know what it is and you've heard vague things, that can really lead to a large amount of misinformation and a lot of fear. So again, mostly due to inadequate information and also a negative public attitude towards MS. So when I knew that I had MS, I thought that I was going to die within 6 months. I had a stupid view about the disease. It was just paralysis and death in my mind, like other people. Concealing disease. So, many also reported that they hid their illness related to this lack of awareness and widespread misperception about MS. They were also disgusted by reactions such as pity or rejection from others. I hid my disease from others because they did not have enough information about MS. In addition, if they knew, they might show inappropriate pity or reduce their contact with me. It was very frustrating for me. Another reason is concealing disease was fear or job termination or unemployment. And this is actually something I had worked with a patient who was very high up in her career when she was diagnosed, had very mild symptoms, and felt that she did not want anybody to ever know at work. And actually, by the time I worked with her, she was on the verge of retiring, and slowly went and told close friends and family and then other people. But she really concealed it up and well into her 60s. And again, out of fear of a lot of discrimination. So another quote here, I might be dismissed from my work if my coworkers or my boss knew that I had MS. Actually, it would have been a disaster as I'm in the midst of highly expensive treatments. So again, another factor of being worried about losing one's employment. So emotional reactions. So again, the initial reaction is unique to each person. It could be a combination of this. Another interesting thing of what patients report is a re-experience of some variation of these feelings coming when MS brings a new symptom or a new challenge. So you can kind of cycle through this all over again. But one thing we want to note, regardless, that this is all entirely normal. But most of the symptoms or most of the reactions that were reported were things such as shock, anger, fear, anxiety, hopelessness, denial, and confusion. And so here are just some quotes of these reactions. For shock, when I found out that my disease is MS, I was shocked. I walked for several hours on the streets without purpose or destination. When the doctor told me, unfortunately, you're suffering from multiple sclerosis, I took the MRI paper from him and angrily told him, you were wrong. I didn't let anyone talk to me about the disease. For a few weeks, I denied everything. Fear. I said, what if my hands and feet become paralyzed? What if I wake up in the morning and I am blind? I was so afraid and apprehensive because I had heard these things about MS. My ignorance and that of my family made the situation worse. My fear and anxiety for the future was doubled due to knowing nothing about the disease. So again, getting back to our earlier statement, a lot of the anxiety and fear, people relate as to being related to the uncertainty or lack of knowledge about MS. So right in there, gives you an idea of what's the first things that people can do to kind of ward off some of the anxiety or fear, right? Because avoidance breeds anxiety. So sometimes you need to kind of tackle this head on, even though it seems, why would I do that if it's something I'm fearful or anxious of? But that's actually what takes away the fear and the anxiety. But just know another key term is that avoidance is what anxiety feeds on. So denial. So after the diagnosis of MS, I went to several doctors because I didn't believe that I had MS. And at that time, I vigorously denied my disease. Confusion. When I heard the name of the disease, I was confused because it's somehow a new disease and has various medications and alternatives. And finally, hopelessness. When I found out that I had MS, I was crushed. Oh my God, what will happen? Everything seemed at an end for me. For a few months, I had no hope for survival. I cried every day in private and confined myself to the house. I feel the same now, too. When I think of my disease, my tears fall. I'm always in a bad mood and I cry all the time. I prefer to be alone. And finally, the religiosity. Many people reported that when they found themselves alone with a refractory disease, they put their trust in God. That reading and listening to prayer was mentioned often as an effective way to gain peace and calm and help with acceptance of MS. And individuals who ultimately used faith actually gained a sense of hope through seeing the purpose and the benefit of their MS. So some quotes on this. Being diagnosed with MS caused me to become closer to God. Therefore, I know the disease as God's grace. Since I've been sick, I have surrendered completely to God, and I can feel the presence of God every moment and everywhere. I trust in God and accept this disease as God's will and a blessing, so I can accept and manage it. I read prayers, I read Zirat Ashura, I listen to Kamel prayers on the TV. Through these actions, I'm able to manage my disease during difficult times. So obviously that was a lot of information, a lot of quotes, but I think, for me, certainly a lot of those quotes, they're poignant, so this is why they're picked out from the interviews. But just some food for thought for everybody listening, what resonated with you when you hear this? Do these feelings and thoughts sound familiar? How has your knowledge or your perspective of MS changed? Thinking back now, depending on where you are in this stage of this, did some of this resonate because that's what you remember being your first diagnosed? And you think back at that now and think, wow, I've changed quite a bit, and why that is. What did you do for that to happen? Or maybe things haven't changed, and maybe also what you just heard can help you kind of explore the idea that what you're feeling now and haven't, changed in your thoughts is a pretty natural and normal reaction and situation. And also to think about, what has been most helpful since your diagnosis. And I hope you guys can kind of think about this now as kind of food for thought and then lead it for our discussion at the end. If you need to, maybe just jot down some notes or some feelings of what you experienced while even hearing those quotes. With that said, I'm going to hand this over to Alexa because, you know, we want to get this sort of interactive and live. So we're going to do a quick poll, kind of assessing some of your feelings that we just sort of mentioned from that study.
Okay, when first diagnosed with MS,
Did we lose you, Kim? Okay, so I'll read it. When first diagnosed with MS, I knew very little about the disease. I thought it was a death sentence. And then you can choose strongly disagree, somewhat agree, and 4 strongly agree. So we'll give it a little bit more time so you can get your votes in. All right, so the results of our poll are: number 1, strongly disagree, or strongly disagree is at 21%, somewhat disagree is at 29%, somewhat agree is at 36%, and then 4, strongly agree is at 14%.
So if we look at that, right, so about 60% kind of felt that it was, that they knew very little or that it was death sentence, but it's nice to see, I think, fortunately, there's more knowledge. I mean, that paper I was reporting on was 2014. You know, in that amount of time, even the amount of medications has nearly tripled for MS. So I do think that MS has become much more to the forefront and much more seen both as something that's certainly not a death sentence and we don't die from MS, but that MS is being more effectively treated, there's more options, and that there's more knowledge. Even commercials on TV, I don't know if we would have seen that a decade ago, right, for medication. So I do think some people are more aware about MS. So I think that that poll may be evidence of that, and that's exciting news.
I agree, Dr. Strober. Kim, do you want to help with the next one?
I will do my best. I did not tell others about my MS out of fear that they would not understand or treat me differently. What is your response? Strongly disagree, somewhat agree, strongly agree. Hey, oh, I can't vote. Okay, good. I start at the bottom like, don't vote. I'm like, oh man, I wanted to vote. All right, we have 36% strongly disagreeing, 21 somewhat disagree, 21. Wow, this is almost like kind of split down 25%. This is almost like everyone's about evenly distributed on this one. That's interesting.
Okay, so that's actually really wonderful news. We're at 42% said that they had agreed with that, but that, you know, 58 then would be, I believe, was 58, saying that they did disclose their diagnosis and not conceal it. And one of the things I hope that gets conveyed from this webinar is speaking to others about your MS, and especially talking with people who have MS is one of the biggest buffers we can have for maintaining well-being and improving quality of life while living with MS. Second thing is too, is that I think helping educate others about MS who don't, not only helps you in your situation and what you can provide to explaining to the people closest to you so that they know what you're going through, but think about how that affects maybe the next person that they hear from that gets diagnosed with MS. It kind of spreads this sort of, you know, you're paying it forward by kind of educating, whether it be employers, coworkers, family, friends, about MS is helpful all around. So certainly we want to try to encourage people not to conceal their diagnosis if possible. All right.
The feeling I felt most when first diagnosed with MS was shock / denial, anger, anxiety, fear, sadness, and hopelessness. I think I say it was more relief for me personally, because it was like, oh, I'm not crazy. There's something actually wrong with me.
Yep.
Okay, 29% at shock and denial. No one at anger in the group tonight. 50% anxiety and fear, and 21% sad and hopelessness. Interesting.
So that poll actually showed up exactly as I anticipated. So that anxiety and fear is something that I think is very prominent early on in the diagnosis, but as I've been finding in my own research, tends to be a little more pervasive all throughout. And it's something we don't study enough. We spent a lot of time focusing on depression in MS, much less on anxiety. And I think it's a real crucial factor for many people, and it needs to be more effectively addressed. But that fear and anxiety, like I was saying earlier, it's from the uncertainty and the variability and the unknown, especially with living with a chronic illness, for many decades, that you're going to go through many changes in your life and then not know on top of that how this illness is going to change or affect you. And, we did a focus group for intervention I'm doing right now, and someone said, like, MS is kind of like the lottery. You never know what you're going to get every day, but your things can change in an instant. And I thought that was a great quote. But I think in that is what leads to a lot of anxiety and fear and uncertainty and inability to plan, which we like to do, or have a sense of control or self-efficacy. So the anxiety and fear is very legitimate, but like I was saying, either feeding into that is avoidance, or not tackling it head on, or not looking for effective strategies to maintain it, or to work against the anxiety, is what is going to just perpetuate it moving forward. So you need to tackle it. And a lot of that, again, is through education. It's through feeling like you can exert some sort of control. It's learning what things you control and what you can't, and being okay with that. But I think the anxiety and fear being 50% is not shocking. All right, are we good to move forward?
Yes, we're good.
Good. So the takeaway message from this, that there's no right reaction. All feelings, there are no right or wrong. This would be no right or wrong reactions. All feelings are normal. That feelings can fluctuate and resurface over time. That seeking and gaining appropriate knowledge of MS is important. Knowledge is power. But I preface here too, too much too soon can also be detrimental. When you're searching the internet and maybe not getting the most accurate information, it's not good. My husband always has a saying, whenever I Google something, he says, "What did you Google? Crazy?" It's true, it will make you crazy. So making sure that you're getting the right information and not overwhelming yourself with too much too soon. Educating others about MS and your experience early on may be difficult, but ultimately I think it is worth it in the end. Putting faith in something outside yourself is helpful and important to recognize that things you have control over and the things that you don't. Acceptance of MS is difficult, but it's not going away, and it's the ultimate goal. It's something that, again, this idea that you kind of have to lean into it because it's there. And also some, can find meaning or purpose or benefit from their MS. And we're going to talk about this at the end today. And they're not just being Pollyannas or wearing rose-colored glasses. There's actually a lot of theory behind how that happens and why, that we'll get to later. And, something for all of you to think about too, has your MS brought you different meaning or purpose? And do you even find benefit from having it? All right, so we're going to talk now briefly about the stages of grief. So Kubler-Ross really, wrote out these beautiful idea of, cycling through these feelings of denial, and then getting angry, and then getting depressed, and then bargaining, and then it ultimately will lead to this, great level of acceptance. To the right here, you can see the experience that most people get, right? It's nothing that clear. It's nothing that clean. You go through these phases over and over again. You don't even necessarily go them in an order each time. And that is what grief is. And it takes a while to actually get to a level of acceptance. So Kubler-Ross obviously developed that model mostly for confronting death or loss. But this was a study done in 1995 where they really kind of expanded upon this and said, you know, MS is very similar. There's a lot of loss, there's a lot of grieving, but there needs to be a bit more to these stages, you know. So a lot of people, it is sort of a shock, then an anxiety or denial, a depression, maybe a more internalized anger, and that may turn into a little bit of outward hostility, but that ultimately getting to this sense of acknowledgement, and maybe that's even the acknowledgement of disclosing it if it hadn't been disclosed yet, that going through all these phases eventually will lead to some level of adjustment, which again is ultimately the goal here. But I'm going to show you, this was one woman's experience with grief, and just let you know, all of the articles and all of these citations, because this came from a web page, I will be providing at the end, and I guess this webinar will also be provided in print format, so you can see those lists then. But this was a woman's sort of experience with grief and how she feels. She identified with the 5 phases. You know, denial was, you know, I can't have MS because I can still walk, and I'm just tired because I'm a working mom. And the anger became, why didn't I go to the doctor for the paresthesia back in 2001, as she was diagnosed 12 years later? The bargaining, if I just eat an anti-inflammatory diet, it will go away. Or if I just can get through this relapse, I'll be able to go back to normal living. The depression that sunk in was, I don't want to get out of bed, and that has nothing to do with my pain or spasticity. Everyone just thinks I'm lazy because I sleep all the time. Maybe I am. And the acceptance was finally that, you know, my life isn't over. It's just taking a different path. And what can I go do about it? One thing is I can focus on what I can do, for one thing. And finally, related to this, you know, that's, you know, Kubler-Ross 5 stages, but, you know, more attention, as I was talking about my shift as well, has been shifted to more positive psychology, that there's a 6th stage that comes from all this, which is finding meaning. So this was published in 2019, and it describes sort of this phoenix rising from the ashes, that once you move past even that acceptance, because some people might say, well, acceptance doesn't sound that positive either. But then maybe there's something to give even after accepting the diagnosis or life with MS. And so back to this one woman's experience, her sense of finding meaning was, well, I can write about my MS using my voice and a life's worth of communication skills in order to help others. I can practice self-care now in a way that makes me slow down and enjoy my life in the moment. I can see how MS made me a better person. It's gifted me perspective, a sense of humor, and a self-knowledge I didn't possess before. So where does this idea of benefit finding or making meaning or finding meaning or making sense of things come from? So again, there's this assumptive worldview or world theory that we hold assumptions about the world. Whether you're aware of this or not, we believe the world is a good place. We believe that the world has meaning, and what we do is meaningful, and that we're worthy of good things, and worthy of also having a meaningful life. And this really provides us a sense of invulnerability, a sense of order, and a sense of predictability. And as I even say that, you're probably all saying, well, none of that has anything to do with MS. MS is completely unpredictable, it has no order, and you're completely vulnerable. And that's the idea, that if we hold this view to be true for ourselves, if it's something that we've gone along our whole life path and felt, we understand why we're here, we understand what the meaning of it is, we understand that you're worthy of being here, that you're worthy of finding your own life's purpose and your own life meaning, and you're on that path, and then you get knocked off of it, you know, or turned around and thrown onto a 180. how do you then come back from that and make sense as to how the heck did this just happen to me? And so that is that sense of sense making or finding meaning. So following this traumatic event, these assumptions can be shattered. It gives us sort of a sense of meaningless, sort of what is this all for? And that really, in anyone's terms, it will help you to find reasons or explanation for why this happened. And I feel like you may think, well, this is a more advanced psychological thing for someone to be able to do, but really innately we all do it. It's just a question of what are the reasons we find or how far do we get in that process. But everybody goes through a process like this when there's a traumatic event in their life. And again, MS diagnosis is a trigger to rebuild one's sense of purpose, order, and self-worth. And through doing that, right, you build a new worldview, right? Because you can't hold on to that truth anymore, really. That a person can experience both personal growth and develop new values, new priorities, and a greater sense of self-awareness. And we call this benefit finding. So this is the process of deriving growth from adversity. Again, this typically follows sense making or finding meaning. And this includes things such as personal growth, strengthening of relationship, and a changing in life's priorities and personal goals. So I remember, a lot of how I started shifting my focus and my research came from, I was running a support group for individuals with spinal cord injury. And, all these people in there were telling me how, one woman, for instance, ended up getting meningitis that led to this injury, and she worked herself to the bone. And she said, I knew I was getting sick. I didn't know how bad it was getting, but I had so much work to do, and ultimately ended up in this rehab hospital. And she said, nobody from work has come to visit me. Why did I spend all my effort on that? Why was that what was so important? Another man told me a similar story, that he didn't go to his, kids' soccer games. He wasn't around for a lot of things. He didn't do much with his wife, but he, had an injury, and his wife slept every night for 3 months on the floor in his room, and his kids came by, and he said, my coworkers all came by like the first few weeks, and I never saw them again. Why did I value that so much and not value what I should have been valuing when it really came down to it? And people talked about this feeling of wishing they had smelled the roses more, and really a big shift in what they valued and what their priorities were and how they would do it differently. And I remember at that point asking them, wouldn't it be great if you didn't need something like this to get you to that point? And, it's been my experience now in my research that I don't know if it comes from not having that experience. It's such a poignant thing that happens for all of us. We revalue things, we think outside the box, we're more cognitively flexible when something really changes our worldview. And I don't know how we would ever teach this to somebody who didn't have a traumatic event. But it would be wonderful if you could have that and be there without it. But certainly over and over and over again, the stories you hear from people is, it has made me a better person. It has made me realize what my priorities are in life and what I should be valuing and what I want to achieve now in this new sort of way of living. So something for us all to think about, and that's going to give us our next, sorry, we were doing the food for thought. Sorry, do this first. So this is Kenneth Packingham, is a researcher out in Australia. I had met him while giving a talk similar to this on adjusting to MS and self-efficacy, and he was phenomenal. He's very unique in that he does this research. He's not necessarily an MS researcher, but he looks at a lot of acceptance and commitment therapy. And he is the first to really bring up the research in sense making and benefit finding in MS. So I wanted to highlight some of his research and also show how this actually, scientifically and statistically, let's say, has shown to have an effect. So this was, again, a large study, 296 individuals with MS living in Australia, 81% female, which is a typical breakdown of our studies, mostly relapsing remitting, mean age about 49. year since diagnosis, about 10. And they completed assessments of their sense making and their adjustment at time 1. And then he brought them back a year later, and he wanted to look again at how they were still making sense, if people changed in that year, but also how their sense of their MS and the adjustment at time 1 would also predict their adjustment a year later. So sense making, he developed this questionnaire, was defined as a redefined life purpose, a spiritual perspective, causal attributions, changed values and priorities, acceptance, and then luck, right? And what he found, and what I want to show, so looking at these factors of sense making and how they may have predicted how people were adjusting a year later, is that redefined life purpose, as you can see here, significantly correlates with one's life satisfaction, being in a positive state of mind, lower levels of anxiety, lower levels of depression, and the caregiver rating was, again, how sort of distressed they found the patient to be. So you would expect a negative or inverse reaction there too, and that's what you find. And then acceptance, again, that ultimate goal of getting to acceptance, we see even greater correlations, that people who were getting to a level of acceptance, you look at how that predicted their adjustment and well-being a year later, and we see that it's a positive correlation with their perceived life satisfaction, being in a positive state of mind, and negatively or inversely related to anxiety, depression, and negative reports from their caregiver. He also developed a measure on benefit finding, and again, this is the stage that might come after sense making. This was among 381 individuals living with MS, mostly again female, mostly relapsing remitting. Same thing, about the same mean age, 47, and months since diagnosis, 117. So again, about 10 years. And benefit finding was defined as personal growth and family relations growth. And on demographics, they found that individuals with relapsing remitting MS had higher personal growth than those with progressive MS. And that time since onset, or at least symptom onset, was positively correlated with personal growth. So again, the longer duration of having symptoms led to a more positive level of personal growth. But also looking at how do these factors correlate with their well-being. It's not surprising that both correlated with positive affect and greater life satisfaction, and sort of a unique contribution here that, again, part of the family relations growth, again, prioritizing your relationships, working on them, valuing them more, not surprising that that is significantly correlated with their dyadic adjustment. So there are any positives, obviously, for making sense of MS and finding the benefit, rechanging, we think about, what can we do living the new normal, that there is a benefit in reshifting or pivoting down the road. And obviously through research, we find this to be significantly correlated or related. So some food for thought. And again, any of these food for thought slides are for us to think about what we want to talk about maybe at the end of this. But has your MS brought you new meaning, purpose, or benefit? How did you make sense of your MS? Are you still making sense of it? Did you find more meaning in things? Maybe a renewed way of seeing things? Have your priorities shifted? Have your relationships changed for the better? So maybe, write down some ideas or thoughts or how this has affected you or what resonates, and hopefully we can discuss this more later. And that's going to take us into our second poll.
Living with MS has caused me to find new meaning in things or renewed sense of way of seeing things. Strongly disagree, somewhat agree, or strongly agree. Okay. 7% strongly disagree, 29% someone disagree, 36% agree, and 29% strongly agree. So a little bit more on the agree versus the disagree section.
Yep. So 65% reporting that it has shifted their priorities or values. And when we talk later, if people are willing to share, I'm very interested in knowing how so. And what was the process like to getting there? And maybe sharing that would also be helpful for the other 35% who maybe are still getting there. So that would be very helpful to talk about. All right, next question.
My priorities in relationships have greatly shifted because of my MS. Strongly disagree, somewhat agree, or strongly agree. Seven percent strongly disagree, 7% somewhat disagree, 43% somewhat agree, and 43% strongly agree. Interesting.
So I realize how I worded that question. It's not necessarily that they went in a positive direction, just that they shifted. So 86% of you say that they did. I'd be interested when we talk later if that was for more positive ways or more negative. But it's not surprising that 86 of you say that they changed in some way, because I think that is one of the most significant outcomes associated with MS or any sort of diagnosis like MS, and something that wasn't given a lot of attention to in the beginning. For instance, nobody studied caregiver burden in MS. It was more for cancer and elderly and dementia, and no one really thought of it as being a factor in MS, but we know right now today that it really is. So it'll be interesting to talk about how relationships have changed. And also, one of the things I really want to highlight is the role of social support and networks, and even that doesn't have to be necessarily your friends or your family, but even just being connected to the community, finding things that you do that bring purpose or meaning that's social. But relationships are just as important as, they've done these large studies that show that when you look at risk factors for health, such as diet, exercise, smoking, whether or not you got the flu vaccine, your social integration and level of social support has a greater effect than those factors. Even having cardiovascular risk disease factors, that your social network is more important in predicting mortality and health. So relationships are important. So let's also think about how people answer that question and talk about that later. All right. So adjusting. So we've gone over the initial reaction to a diagnosis, the stages of grief that may come from that, and the host of emotional reactions as well that can come from it. But fortunately, there's been a host of literature done on how do people adjust to it. And this is a quote from Gandhi. Life is a continuous process of adjustment. It leads us to being better self-actualized people. It's also just something that if we're not flexible, right, buildings have to be able to bend in the wind a little, bridges have, if we're not flexible, we'll break. And that is true of all humans as well. So this again is a large meta-analysis of 72 studies that examined the factors that have been shown to be associated to adjustment to MS, both negatively and positively. And these factors have been divided into 8 broad categories. So these are the 8 domains. We're going to talk about these one by one. Stress and coping, social support and interactions with others, which I just mentioned, cognitive models of psychopathology. So how do you perceive the world? What are your thoughts and behaviors? Illness and symptom cognition. So what do you think about your MS? Perceptions of control and self-efficacy. This is a really big factor. We study this a lot. In fact, many of my interventions are aimed at improving self-efficacy because we know it is such a very significant factor in adjusting to MS. Positive psychology, which I mentioned, that's another domain here. Engagement in health behaviors, and then finally, a miscellaneous factors domain. So we're going to talk about these one at a time. So what do we know about stress and coping? So obviously, a higher level of perceived stress is known to be associated with depression, anxiety, psychopathology, reduced mood, worse life satisfaction, and poorer psychological well-being and quality of life, and ultimately leads to a greater level of distress and poor social adjustment. So again, this is kind of paraphrasing, right? It's over a lot of studies. So looking at 72 studies, they looked to see any study that talked about stress and what were the outcomes associated with it. So that's why this is sort of a mouthful. Emotion-focused coping, things such as wishful thinking or avoidance, related to worse adjustment, which if you've been listening earlier, we know any sort of avoidance will lead to worse adjustment and worse outcomes. On the flip side, problem-focused coping or seeking social support and more adaptive emotion-focused coping, such as a positive reappraisal, which is sort of the benefit finding, has been related to better adjustment. You know, it's interesting though, these have sort of lower relationships or weaker relationships. The problem, you know, problem focus and all this leading to better adjustment. A very, very consistently strong relationship is shown though. Individuals that avoid, you know, do emotion focused or avoidance coping, we know across the board will have a worse outcome. Social support, interactions with others. So high perceived support significantly found to be related with better adjustment, and actually high perceived social support is one of the biggest predictors, if not the biggest predictor, of depression in MS. On the flip side, you know, some people, we don't think about this, but it's really true, but an over solicitous or critical response from our significant others, not beneficial to adjustment. So what do we think about cognitive models? So having a cognitive distortion, so whether you catastrophize things, you overgeneralize, or use sort of selective abstractions where you're kind of not able to see the big picture about things, learned helplessness and poor self-efficacy have been explored in MS. And what they found out of all of this, that this sense of learned helplessness is the greatest predictor of a worse outcome, and also the greatest predictor of depression. And that negative attributional style with stable and global attributions. So that means, so, you know, we call this like the 3 Ps of pessimism, that when you're faced with a bad event, we have a way of viewing it or attributing what happened. And the 3 Ps of pessimism is that you see it as being pervasive. So sort of that stability that, you know, this is going to be forever, that you see it as personal, that it's something that you, you know, you blame yourself, you think it's your fault. And then I'm forgetting actually the 3rd P, pervasive. Oh my goodness, personal. Oh wow, forgetting the 3rd P, but we'll look that up. So I should have that right here in my other, I'll come back to that. But basically having these attributional styles are going to lead to a greater level of depression. When we get to the idea about illness and symptom cognitions, so if you, they found that the way the illness representations were related to worse adjustment, if you attribute a wide range of your symptoms to MS, so, you know, I always use the example, and it's not the great one, but where, you know, somebody says, well, you know, I broke my nail and I think it could have been my MS. You know, it's a total global exaggeration, but the idea being that it's hard with MS because you're, maybe after you got diagnosed, you realize, you know, I think I had these symptoms for the longest time, and maybe I just didn't know that that's what it was. And then after the diagnosis, it seems like everything can become your MS. And it, again, creates just a tremendous level of anxiety and fear. So the tendency to do that will lead to this, again, this idea that you'll have worse outcome. And again, not surprising, but a belief of a lack of personal control over the illness will lead to worse attribution, and a perception of severe illness consequences is related to a worse adjustment, and representations of a cyclical illness timeline. So kind of feeling like you're kind of always going through this same cycle, the same thing over and over again, and there's no way kind of out that would lead to a worse outcome. And believing that MS is caused by psychological factors. And finally, a lack of coherent understanding of MS, which again, we mentioned before, sort of that lack of education or knowledge about MS is associated with a worse outcome. So also illness uncertainty, which includes a perception of ambiguity, complexity, deficiencies in information, and unpredictability regarding the disease, relationships, and future. And what they found, which is not surprising, that high uncertainty is related to a worse adjustment. So this is something I want to highlight. It's really interesting. So depression, for instance, we know that depression is pretty high initially following a diagnosis. But when you follow people over time, at about 10 years, we see that the rates of depression are much lower. And you think to yourself, well, why would that be? Especially given that they might have a greater level of disability, because for some people, maybe after diagnosis, it might take, 1 to 3 to 5 years before they're having a, significant level of disability. But what we come to realize is that for some of it may be that these are individuals who either A, they just really learned their MS and they're battling it and they know what's to come, or they may have transitioned actually to a progressive course. And in some ways, it's almost as if that brings them relief of knowing, I know what this is now. Having a relapse remitting course and not knowing is the next attack going to be the one, that maybe that leads to a better level of adjustment. So that's one theory. Obviously, the other theory could be you're 10 years older, right? So depression does, sort of a paradox, but people think that as we get older, especially as like when elderly people, when they're losing partners and losing family and friends, that they should be more depressed, and they're actually not. The most depressed are probably the 40-year-olds. But the idea that maybe people just become wiser as well. But I do like to give a lot of credence to the idea that I think that high level of uncertainty initially on, while you would think that would be, obviously you'd be depressed, but that maybe it would grow over time as things got worse. The fact that it doesn't gives me hope to think that if people can gain a greater sense of certainty and have less anxiety or fear, they will be better off despite their MS over time. So perceptions of self-control and self-efficacy. So a general locus of control. So that's sort of how do we think things happen? Is it something that we have control over, or is it act upon us? And they found that obviously individuals with high internal locus of control were more likely to have lower depression and distress, more positive mood, and be happier. And that there is even health-specific aspects of self-efficacy. So we measure this a lot, like how much do you think you can manage your fatigue, or how much can you prevent fatigue from getting in the way of your social life or your activities? That these aspects of self-efficacy are also highly associated with better adjustment. So finally, the positive psychology, and we'll talk a little bit about this, later on with gratitude, but optimism is a real component of positive psychology. Individuals who can engage or have an optimistic approach report lower depression, less anxiety, less negative affect, more positive affect, and better physical, social, and psychological adjustment. Low levels of hope, not surprising, associated with increased depression and vice versa. And benefit finding has been found with positive adjustment, which we showed you with Kenneth Packingham's work earlier on. So what about engaging in healthy behaviors? So engaging in positive health behaviors such as diet, exercise, you know, going to the doctor, taking better care of yourself, not surprising, also related to better adjustment, but even in terms of marital relationships and quality of life. One study showed that the continuation of exercise behavior over time predicted a continued enhanced quality of life, and that if you perceive barriers to your engagement in health behaviors, that can also result in worse quality of life. So the summary of this, they break this down into cognitive, behavioral, social, environmental factors. What is associated with successful adjustment? So things such as positive coping, positive reappraisal, problem-focused coping, perceived control, even over generic life events. So, you know, how do people approach other things in their life is a pretty good predictor of how they're going to manage and face their MS. Self-efficacy regarding their MS management, optimism and hope and benefit finding, general self-efficacy, acceptance of illness, spirituality, behaviorally, again, problem-focused coping or seeking social support, engaging in positive health behaviors, and the social factors. And again, I highlight the ones that are in bold because these are the ones that have found the strongest relationships with it, but high perceived social support and positive relationships and positive interactions. What is associated with poor adjustment or adjustment difficulties, high perceived stress, poor coping, so emotion focus or avoidance coping, illness uncertainty, appraisal of MS as a threat, dysfunctional cognitions, helplessness, perceived barriers to engaging in health behaviors, unhelpful illness and symptom representations, and unhelpful beliefs about pain in particular. And behaviorally, again, coping through avoidance and an unhelpful response to one's symptoms or perception of symptoms of sort of, again, that everything being MS. So we're going to talk briefly now about emotional. It's 8:57, so I'm going to keep on track here. What are some of the emotional disturbances in MS? So, you know, depression obviously is well known, and we talked earlier about grief, but grief is transient. Depression is much more stable and tends to remain longer in MS. And a poor adjustment or failure to accept and cope with MS really will sustain that depression after the diagnosis. Depression, we know, is much higher in MS than among healthy controls and individuals with similar illnesses. Incidence is about 50%. And, you know, there's a greater suicide risk, 2 to 7 times percent higher among people with MS. And again, it's considered to be a combination of biological and psychological contributors, and that's what I mentioned earlier. So, you know, one reason why depression was always studied in MS is even in Charcot's description, he would say that the people with MS, they would just sort of fall apart in tears, that there was a real component of depression in MS. And it is, in fact, found. There's a biological reason for it. You know, individuals who have greater lesion load in the temporal and frontal lobe lesions tend to be more depressed. And another thing is people who have more lesions in the brain versus cervical cord tend to be more depressed. So there's a real biological etiology for it. But again, the psychosocial factors are things such as perceived stress and social support are such big contributors. It's, you know, it's kind of the onion. You know, these are layers that we can get rid of. Again, use of emotion or avoidant focused coping is such a predictive one. And again, what I mentioned earlier, the fact that it's greatest in the first 10 years of the illness and then seems to subside gives some idea that people who have learned to cope, learned to manage or accept their illness, or develop some level of certainty or predictability will show less depression. Anxiety, again, as I mentioned, it's much less studied in MS. Lifetime prevalence around 35%, more prominent in the earlier stages of illness, much higher among women than men, tends to be comorbid with depression and associated with engagement in greater negative health behaviors, having greater level of stress, and again, suicidal ideation. So to conclude, we're going to finally now talk about, well, how do we live well with MS? I also just want to come back. The 3 P's of pessimism is permanent, pervasive, and personal. But that permanent and pervasive, I guess that's why I couldn't remember, they're kind of the same thing. Is permanent thinking like this stable part, that this is never going to go away. This is always how it's going to be. The pervasive part being that it's not just this situation, but you kind of tend to overgeneralize it to every situation. And then that personal part saying that it's me, it's my fault. Optimists will see it very differently, and would say that people see things as temporary. They see it more as an isolated incident, and they also see it as being more external or to other factors other than saying it's all their fault, is an optimist approach to it. So sorry about forgetting my third P. So living well with MS, how to do it. I hope that what we've talked about today, normalizes much of the reaction, and the fact that there is a new normal associated with MS and a long road to adjusting to it. And we looked at all the factors that help you realize what would be kind of, what's the best toolbox, or, what are the cards that you want in your deck when facing MS. So this is just sort of now a summary of how do we look at that and put it forward. So one is to know that you should experience your emotions, and you're going to have a wide host of them, and that these emotions are fleeting. And again, even negative ones serve a purpose. So just as like a happy moment is not permanent, either is a negative one. And a negative one is an indicator of something, and you don't try to run away from them. So experiencing all your emotions, acknowledging that things are rough. On the flip side, recognizing the good things when you're happy. And again, we'll talk about gratitude. One of the things is considering starting a gratitude journal. Don't compare yourself to others. Build and maintain your social network, including, and probably more important in some ways, other people living with MS. Find healthy and productive means of coping. Accept limitations and work to your strengths. Engage in self-care. Find a doctor that you trust and can communicate openly with. Stay cognitively, physically, and socially active. I can't emphasize that enough. And also know when enough is enough and don't overdo it. We talk about, especially with fatigue, things like banking energy, just, again, engaging in those healthy behaviors. Part of that is knowing and understanding your symptoms better and knowing how to more effectively manage them. So now, and the last thing is, I talked about this earlier, but this idea of positive psychology talks about gratitude. Gratitude is not just an emotional state we have, but has been thought of as being a trait. And people who are high on trait gratitude appreciate the benefits given by others to oneself. They value simple pleasures, and they experience a sense of abundance. And it's well appreciated across a multitude of cultures that gratitude is a significant predictor of life satisfaction. But it also can serve as a mechanism of resilience. In MS, so there's been one study so far that has specifically looked at the role of gratitude, and it has been shown to be a predictor of quality of life, even when taking into account the objective and perceived levels of fatigue, cognitive functioning, depression, and education. So what are some things you can do to practice gratitude? The 3 good things. So every day, at the end of the day, just saying to yourself 3 good things that happened that day. They could be big, they could be small, it doesn't matter. 3 good things and why. And again, like I mentioned, maybe keeping a gratitude journal. Saying thank you regularly. We don't say it enough, but really going around and saying it to people really makes a difference. Stepping back daily and appreciating what you have rather than paying attention to what you don't. And looking for others' good deeds and also thanking them regularly. So again, some food for thought, and this does not have a poll, but we will hopefully be able to talk about it a little bit. But think about what you did or can do and less on what you did or cannot do. So really paying attention to the positives in your life. And again, I always say this with patients too, when they say to me, oh, I had so much, just a little example, I had so much to do today and I didn't get anything done. And I said, really? Well, what did you do today? And they go through a whole list and you say, well, that's like 8 things. And they're like, oh, but I didn't get this done. And I said, well, that was 2 things. if we really go back and look at it, you did quite a bit today, right? And focusing on more of what you do and what you can do than what you can't. Again, being grateful for family and friends, support from others with MS, and something we probably don't pay enough attention to all the time, but being grateful for available healthcare and resources at times to make sure people can get access to medications and treatment and MRIs and wheelchairs and cooling necklaces. We have a lot of resources, and being grateful for that is really something too. All right, so with that, thank you all. I hope this was helpful and educational, and we will open it up for questions and discussion.
Thank you so much, Dr. Strober. I am so glad we are recording this because I'm going to have to watch that again and again and again. And Dr. Strober has been very gracious to give us her slides. So the slides will also be posted on our website, so you don't have to worry about trying to write everything down. So I would love everybody to get their questions in. These questions are anonymous, so please feel free to ask what you want. I'm going to go ahead and introduce our second guest. My name's Kim, by the way. I'm the moderator. I'm also the moderator from the MS group, and one of our moderators is Carly Pozakowski. She used to be one of our moderators. We miss her dearly. She is a psychotherapist who has MS. So we had to bring her on to bring her perspective. She's got her master's in psychotherapy. Unfortunately, y'all, you cannot have her. I know everyone wants to see her because she has, MS and understands, but you have to be in Michigan right now. And she still has limited practicing right now because she is still a little bit on the newbie side. But we are so glad that she's here. Thanks for coming, Carly. So glad to see you here. Okay. I don't see any questions yet, so we get to start with my questions. Okay, so I will ask the questions. You both answer. If nobody doesn't want to answer, just we're good, and we'll just go on to the next. My first question, I asked my MS group this morning, what did you want to hear about? And they both had a really sensitive part. The one, she is a grandmother of 6 grandkids, and the other one has 3 kids, one in middle school and high school, and they both really, it's really hard for them what they envisioned as being a mother and a grandmother, and that's very sensitive to them. It's very tender. Like she talks about the one that's a grandmother. She talked about, my grandmas were very active with me when I was a kid, and she uses a wheelchair. How is the best way to get to that, being able to let go and accept and go, I am a fabulous, amazing grandmother, mother, regardless of what has changed with me due to MS?
Dr. Strober, I'll let you take that one first, because again, I'm about a year in. So I have my own opinion, but.
Yeah, listen, years of experience doesn't make much of a difference, really. My first reaction to that, though, is what I mentioned earlier about working to your strengths and not your limitations. So what, you find activities then that you think are if we make them special, for the grandmother idea, what, she can bring them to a table though, and they can do a craft all the time, and they can create little hobbies that they do, and maybe make it like a special annual thing that they do. So you have to kind of think outside the box, that if you had this representation that you were going to be on the playground with your grandkids and doing all that, and you can't, well then think, okay, well, just the same way you have that memory, they're going to have a memory of something else if you do it to that level and to that strength of what you can do. It doesn't need to be what we had, it's just that shifting of focus, right? So that would be my first thing. And I think there's a large thing of, again, MS affects mostly women, mostly at the time of their lives when they're starting families. Some women were told not to have children initially, back in the day, that it would make their MS worse. That at least has now been, what's the word, eradicated. Doctors don't say that anymore, but I think it is a big role of what you think you are going to be as a mother, or a partner. And sometimes we just need to think more about how does it look differently, and what can I do to my strengths, and not focus on what what I can't do or what I had imagined. And that's not just to MS, that's to anything, really.
Mm-hmm. Yeah, I think the flexibility is such a huge part of it. I take notes all the time because I have MS. That like that's just part of how I would operate. But like I wrote down I am enough because I think that's the point where all of us can get to or need to get to, but there's all this like internalized ableism of like what are my limitations and living within them. But like you exist as a human being, that is enough. And like however you show up as a grandparent, as a parent, as a sibling, as a, you know, a spouse, that's enough. And like living within those means, that's enough. That's where I'm at in my journey anyway.
Okay, we have a question from the audience. I will try not to butcher it, guys. Bear with me. I would like to know what you might say to someone who experiences a type of survivor's guilt. Treatment works for me and I'm doing pretty well. And at times I feel like I'm doing better than others who have further disabilities than I do. That's a great question because we're all, you know, experiencing different symptoms, and some of us are seeing more severe symptoms than others.
Mm-hmm. Yeah, that's a great point. And if you don't mind, I'll speak to actually in my progression of my disease, I am still in relapse remitting. But there is always this like internalized part of that, like, you know, with how the disease is progressing, like withholding it. Like Dr. Strober, you were talking about that during, you know, like not wanting to share that information because, well, I'm doing a little bit better than like these other people that I know. You know, I don't use a mobility aid but I have used a wheelchair. We're all temporarily able-bodied, right? So that might be the case, but today that's okay. I think it's part of what Dr. Strober was talking about though, is like, it is kind of a lottery of like, what does today look like? Tomorrow might be completely different. But I think I'm still navigating, how do I live with that? How much do I share? What does that look like for peers? I don't know that I have a good answer to that.
Yeah, survivor's guilt was really studied in cancer research. And I think, and even with patients I've worked with, a lot of it becomes they start to question, why am I lucky? Why me, not them?
Mm-hmm.
So that's really the question of what it gets at. Which, if you think about it, I would turn that around and say, yeah, why not you? And it gets to a level of making sense and benefit finding and turning it into, rather than spending all your effort trying to figure that out, because you're not going to find that answer, what does it mean that you are still able to do what you can do? What does it mean that you're, you know, saved from this for now and you have this life in front of you to live? And put your energy into how do you make sense or find the benefit in that and move forward.
Mm-hmm.
The shifting of energy.
Mm-hmm.
You know, and you can't question why you and not them, because again, that gets also back to that world assumptive view, right? That the world's a good place. So, you know, do good things happen to, you know, bad people and bad things happening? If we get stuck in that,
Mm-hmm.
We don't move forward.
Mm-hmm. Yeah. And that's a great way to connect with community too. Like there are so many of us at varying levels of the disease. There are still folks that we can connect with.
Yeah.
I did not pay Dr. Strober to like talk about peer support and people who have MS. So I'm like, wow, she's really putting a thing on for our MS support groups on the second and fourth Tuesdays every month. Just let you all know that. I just like, wow, she's really hitting this one hard. Let's go. One of the things that I love that you talked about was avoidance breeds anxiety. So we know we're already dealing with a lot of extra, you know, when your world is just kind of in upheaval and you're trying to figure out what way is up and you like figure it out and then it goes in upheaval again. And did you guys want to just touch on that again? Like how, I mean, when you don't want to do, because you know, change is hard. Changing your thinking is tough, and And you talked about if you're not flexible, you will break. And I think that's something I learned with MS. I was flexible before, but man, am I really flexible now, because I have found it incredibly therapeutic in me and learning how to adapt. And so, just guys want to just talk about real briefly about what are some of the things that we might instinctively try to do that are actually that may not really help you in your journey with MS.
Well,
Who's
Carly,
this?
do you wanna take that first?
Well, honestly, I'm trying to think of, you know, how would I love the example that you use, and I think Kim and I we were talking earlier today of like, if you are inflexible with anything, but let alone this disease, you don't really have the option of, you know, like MS is gonna hit you with the relapse. In my case anyway, but like for whatever that looks like, if we don't become flexible in it, your body will let you know.
Yeah. So, and again, I like using, I use the anxiety, the avoidance breathe anxiety, because I use it also just with my regular patients about anxiety, that what we're most fearful of or most anxious about, if you just avoid it and you don't face it and you don't come, you never, it's kind of like exposure to a dog, right? You're so fearful of a dog that you never go near a dog. Well, life's going to be really hard then if you're so avoidant of dogs, because depending on where you live, dogs can be anywhere, right? And it's limiting your life. So at some point, you need to face a dog and then come to realize, oh, wait, that wasn't so bad. But if you don't do that, you're missing a whole world of things. So I think the same thing as with MS, though, it's more about the anxiety. And as we're saying, like, it's very much from not having the knowledge or education, but you kind of have to throw yourself in. And not too much that you go into like panic zone, right? But enough that there's like a growth zone, right? So we have our comfort zone, we have a growth zone, and we have a panic zone. MS throws you into a panic zone. You might want to revert really fast to your comfort, but you got to slowly make yourself way back out to the growth zone, which is where you're going to learn how to live with MS. It's not going to be in the panic and it's not going to be in your comfort, right? So you have to, you can't avoid. You have to move, you know, I use leaning into it, right? Is saying you can't deny it. It's not going anywhere. It's not going to change. So best be to get working on it and do more problem focused, adaptive coping and not avoid.
Yeah, and similar to like your dog analogy, as the more we like push things off, the bigger and hairier and scarier they get. So the longer you spend not looking at it, the bigger and hairier and scarier it gets.
Yeah. And, you know, there's, you know, philosophers that we use to develop like the basic tenets of cognitive behavioral therapy. And, you know, one great quote is that, you know, man is not disturbed by things, but by what they make of it, right? Because a dog could come in here and I could go forward to it and somebody else can think it's the scariest thing in the world. It's still a dog. It's what two people made of it and how we perceived it.
Yeah.
Same thing with MS.
So how do you get yourself or clients of yours to be like, I don't like being in discomfort. I know that's where the growth is at. That's where I need to be. How do you like gently like, okay, well, we need to get you slightly, keep you there, you know, slightly. So I know it's not comfortable, but you know, we need to get you. We want you to move forward and get to that point where you're having that higher life satisfaction. You're having a positive outlook.
Right.
What are your tips and hot tips and tricks? Because we all are stubborn, you know, in general as people, and change is very hard, and MS forces you to change, whether
Right.
you want to or not. And sorry, that's my cat, guys.
So, you know, obviously a little different. A person who's coming to therapy is coming because they know they need to be in the growth zone. Either they're too far in the panic or they're too far in the comfort and they want something to change. That's why they show up. MS, it's not, you know, a selection. Like, hey, you know, so, but it is still a factor that then says, I need to, you know, that you need to make a change. So I think the little thing is doing obviously small steps, right? You don't do anything big, and it's in the evidence. So you need to slowly guide a person into, well, what does it mean to come out of that comfort zone on the smallest things? And okay, think about where you would have been if you didn't, and think about where you are now because you did. Check. Next thing we need to attack. Okay, think about where you'd be if you didn't. Think about what it will take to do it. Let's try doing it. Is it, you know, the proof is in the pudding. Are you in a better place because of it? Check. Well, it's kind of like going to the gym. No one ever goes to the gym and then say, man, I really wish I didn't do it. But how much of a struggle is it sometimes to get to the gym? You can come up with every excuse, you know?
Mhm.
So it's sort of that evidence thing of, and then over time, kind of like going to the gym, then all of a sudden when you don't go, you kind of miss it because you're like, oh, I don't feel so good. It's that same thing, getting people to make those small steps over time with the idea that it becomes habit, that they want to keep doing it because they see the benefit of it. And I say all this, if it was that easy, we'd all be doing it. It's very hard, you know, but when a person realizes that a change is needed or that they're going to have to tackle something at some point, I think people will slowly move to that growth zone or
Mhm.
get them out of the panic zone. Sometimes the patient's coming in from that and you're bringing them back down to say, we get you to a place where you can actually see this more clearly and focus on what's in front of you.
Mhm. Well, and I think with my clients too, I like to set them up for that. Like it is going to be uncomfortable at times, but that's why they're there. Like Dr. Strober said, right? Like once you're seeing us in therapy, a therapeutic setting, like you want to be there, you want to be making changes. So I like to ask clients sort of like where they would like to be. I don't necessarily see a ton of like clients who have MS right now, but I work with a lot of folks who have chronic illness or chronic pain. And so it's thinking about like, where is it that you want to get to and how do we make small steps to change that? Because again, you're not going to use the gym analogy. You're not going to go to the gym 7 days a week if you're like sitting on the couch watching 5 hours of TV a day, right? So like, how do we make small changes? Like, what do we do differently today? What can we do now to get you to where you want to get a little closer to where you want to be?
Good question. Something that you mentioned, Dr. Strober, earlier, and I'm not going to say it right, but you'll figure out what I'm talking about, was you're talking about educating early on and like telling others, and how you said it was hard but worth it, because that's something that people really struggle in. Do you want to talk a little bit more about that? Carly, too, you can add as well.
Yeah, so I think it's, if you look, so it's kind of my extrapolation, right, from both my experience with patients, but also what you see in the literature, that it seems that, and again, extrapolating from it, there's a large level of social isolation and loneliness among people with MS. And a lot of that, again, looking at data, might be because of, well, they're fatigued, it's hard to get out, things aren't accessible. But, you know, a study that was done in the UK, they said the biggest reason was a lack of understanding of people, of their MS, whether it's in the society or their friends and family. So I extrapolate from that, you know what? Important to educate people about MS. Important to feel like you can go out and do things and be in society and be in the world because people understand what you're going through. You know, MS is such a silent disorder. People say like, or silent disability, oh, but you look fine. You don't look tired, right? I think getting the word out, explaining to people what MS is, the good and the bad, so that people with MS just feel free to engage in their world, you know? And the fact that I think we look at the fear and the uncertainty and the anxiety being such a predictor early on with the diagnosis, and people saying, well, it's because I knew nothing about MS, or people had misperceptions about it, well, then we need to eradicate that too, right? We need to figure out why is that happening. So that's where I think about educating people and taking, and I think it's a process too of feeling like you're educating yourself too, and you're acknowledging MS when you're telling people about it and taking that deliberate time to say, this is what MS is and I have it. I just can't imagine that doesn't become a helpful thing for people. But I'll let Carly probably respond better to this. Of, I don't know if you've had patients too that sort of feel like, you know, I don't want to let on about my MS.
Well, yeah, and I actually, I was taking notes of your presentation as well, because I found myself like falling into that when I was still like in a regular workforce. And there is such like a stigma about it, and you know, I don't know, I had actually 10 years this year, so hearing all of that data too is like really interesting. I think Kim, you hit 10 years for you this year as well,
Day
right?
one, get my party, have my MS
Right, right.
party.
So it's like, it's such a different feel of it now. Now I am to the point where I think it can be really helpful for people to have that education piece. But early on, I was still learning so much about my diagnosis that it was much more difficult to like share or have like that feedback from folks of like, oh, like that was the worst of like that pity, because it's just, that feels so gross when you're like trying to, explore this on your own. But it can be really helpful to have that education piece for folks and share that. But I think that comes with time and experience in living in this disease.
Okay, this is kind of a twofold question here. So what I want to say, okay, so we talked about talking to someone, and I know one of the struggles we're currently having since the pandemic is it's really hard to find a therapist. People are like, they're not calling me back, or they don't take Medicare, and all these issues. So I know when I went to therapy, that was huge for me, because for me, just to be able to just kind of vent and not feel like a burden to my family, like, oh my god, they're just thinking I'm just complaining all, like, I'm already burdening them enough, like I don't want to burden them anymore. But what are your recommendations to help if you want to find a therapist? What do you recommend? What to do with all the pandemic issues? And then also, I'm totally losing my thought because it's an MS moment right now, guys. The second part of my question about what was it? Therapist? And the second part, I'm totally blanking. You guys will figure it out. Such
Well,
a
I
great
mean,
moderator.
another really great plug for the MS support group, because although like we would love to see folks in like one-on-one session, I think to the point of like the isolation, in any way that you can find to connect with other people who are living with the disease can be immensely helpful. Early in disease, like it can be really helpful to see folks in person. But with like the group that you guys do with, being online and it's really accessible, I think you guys have it on YouTube and like closed captioned and everything. So a lot of the things that could be really challenging are less so. That being said, yeah, there are a lot of restrictions. I know on our side as well, like I'm restricted in who I can see at the moment, just from the state, but there are so many challenges there, and finding a good fit is so important, more so than like who is going to accept insurance or Medicaid, Medicare. Yeah, I don't know if that is a great answer to the question, but it kind of is what it is right now. But there are so many other resources too. I think I want to say Better Health, like the text ones, there are so many options for folks right now. I don't think you can have continuity of care with like clinician throughout, like if you use those types of services from what I understand of them. But there are lots and lots of options.
Yeah, and we know from so much of the literature that the peer support groups are actually most beneficial than even individual psychotherapy in a lot of ways. And especially early on in the diagnosis, where a lot of people would say, I didn't want to be in a room full of people. I didn't want to see my future or my fate, kind of. But again, avoidance begets anxiety. So you want to do that. And in many ways, from what we know, and the MS Society, I used to be a facilitator for support groups. They did, well, funding was also a part, but they did away with it, and they actually just do all peer facilitated groups now as well. But the host, and that's actually, I put that as one of the resources in the talk, But the MS Society has like the MS Navigator program, the MS Advocate, the social support. I mean, they have a support group for anything. I was doing one on like cognitive issues. And the MSAA, I think I also listed them. There's so many, and you guys have, I mean, I would encourage everybody to get involved with a peer support group.
While in addition to that, one of the things that I was kind of craving in my local area and couldn't find was a peer-to-peer support group. If you don't have one, I highly recommend creating one, which is what I did. But you don't look sick, like I did that as an in-person group before even like the ANCAN supported group. So if you don't find it, build it and they will come, as they say. For what it's worth.
Yeah, great. That's really great.
Okay, I was told I get to do one more question, and this is tough for me to do the last. You guys know this. So the thing that's hitting me is strategies to get to that sweet spot of like, okay, I have acceptance, I'm doing well. And I know for me personally, two of the biggest hits for me is my sense of humor and gratitude. I actually had a guy challenge me in January when I talked about MS. He's like, you just told me everything about MS is negative. What are all the positives? And he really made me think outside the box. I'm like, wow, I never thought about that before. But there are like, for me, and I'll just name a couple of them. For me, a couple positive things was all these amazing people I would have never met if I didn't have MS, people who do have MS and people who do not. And also because of my cognition issues, I am in the present all the time pretty much because I don't have the brain power to be in the past or the future, which makes a little bit planning my party a little bit on the tough side, but that's okay. So I don't know, like, what do you guys, when you see people that are really like nailing like living life and taking it in stride and finding meaning, what are these characteristics of these people? Like I want to know if it's because I want to do it, and then I always have the problem where like I know I'm gonna have upheaval in my future, and I was like, oh god, am I gonna do this again? Like I want to, like, what is the shortcut to get through this at the shortest duration and not as severe? That's my big question. How do I do it? Because I'm gonna go through that process again, like in the fall. Lack of daylight really affects me. It's a tough time for me. I know it. I'm prepared for it, but I just still always want to know, like, how do I make it a little bit less painful, a little shorter, and not as severe? So
Something that I find helps me, but I also work through with clients of mine, is like having, because I need reminders all the time. I joke, like I keep notes all the time. I have like in my gratitude journal, which I also keep, a list of like self-care things. Like if I'm having a rough day and I can't think of anything, like I have a go-to of what are the things that I need when I'm feeling down or anxious. And it's just a go-to list that I have when I'm feeling well enough to do that. And I think a lot of people find that really helpful, because when you sort of are in that downward spiral of like finding yourself in a more depressive space of like, whether it's time of year or what have you, that can be a really great reminder. And they might be difficult things to do, but they might just be really little things. I do a play on the 3 things that Dr. Strober was talking about. I actually write down 3 things that I'm proud of that I did every day. Because it might be, I took a shower today, depending on like if it's a really tough day, or it might, it might be I took a walk today, depending on what your ability level is at. But I find that to be really helpful, in addition to writing gratitude, the things that you're proud of. So I don't know if I answered your question. I apologize. Also, it's late. My brain's a little foggy.
Yeah, I mean, I think, you talk about getting to that sweet spot of people who just sort of, I remember when I first started in MS research, I was working in an MS clinic, and, my job was actually to screen patients for the research studies and assess their depression. And that's where I got interested in it. But I remember coming in and this woman was telling me how she was going to Israel and she was climbing this mountain. And I'm looking at her thinking, she's nuts. You know, she's really, and I mean, she was her, and she got up and I had to do her meter, 25-meter walk, 25-foot walk too. And I was like, oh boy. But I was like, you know what it is? She's just transcending everything. And I was like, what is that sense of this woman that she just took it as like, well, here's what you gave me and here's what I'm doing with it. And I think, people might say, well, is that just the person? Is it just, there are some characteristics of people who are going to see any life challenge like that and just, but does it mean that people who don't innately do that can't learn to do that or find that for themselves? I believe they can, but I think, again, it takes a lot of the introspection of, what do I make out of this? And it's not even like, again, many times it's because a traumatic event happened. I wish that we can all get there without a traumatic event, to really be mindful and stop and think, what is the purpose and meaning of my life? What do I want to be doing? And what does that life look like and how do I achieve it? Point blank, right? Regardless of MS, and it's to say, well, if I can't do it that way, how can I do it and come around and do it differently, but still get to that ultimate point and be flexible.
That is a great way to end this. I could talk about another 5 hours, but I know you guys are East Coast time, so you're already super tired. So I wanted to show a quote to close this up. Thank you so much, Dr. Strober. Thank you, Carly. It was so awesome that you guys are able to do this today. And this is our quote from Elizabeth Kubler-Ross that I came across last month in my book club, and I just lost it. Here we go. The most beautiful people we have known are those who have known defeat, known suffering, known struggle, known lost, and have found their way out of the depths. These persons have an appreciation, a sensitivity, and an understanding of life that fills them with compassion, gentleness, and deep loving concern. Beautiful people do not just happen. I will turn it over to Rick for our closing. Thank you, everybody, for joining us tonight.
Oh my gosh. We lost Kim. She just went out. I wanted to thank her. There she's back. There she's back. And I wanted to thank, first of all, Dr. Strober for such a comprehensive presentation that I know is going to get a very large number of views. We should have a sweepstake, but it will get, I suspect it's going to get hundreds of views. To Carly, who, it's just a joy to listen to you, Carly. You're so poised, and I think back to 2 or 3 years ago, and my gosh, it's kudos to you, and I'm really, it's great, and every success. And to our very own Miss Stroh, we could never do these webinars without her, because she brings such life. The one thing that struck me, and I'm already talking to Alexa about this, is that whilst this was an MS webinar, if we had quotes from people with other conditions and put in a different condition instead of MS, it would be very applicable to other things. And maybe we can convince Dr. Strober to do something very similar that we can take out to our whole audience, because I think it's really beneficial. I feel that your observations and the Kubler-Ross model and all of that. I mean, I love the squiggles next to the Kubler-Ross model, because that's what it is, man. You're up, you're down. It's a roller coaster. Let's face it, it's a damn roller coaster. You think you're out of denial? No, you're back right in there. We have a lead moderator for our Care Partners group, who we call the Egyptian Queen, because she describes herself as the Queen of Denial, and that's, I call her Your Majesty. And she spent her career as a women's health nurse practitioner. And she spends her life in denial. Anyway, thank you so much. Thank you to the audience for we hope you got a lot out of it. We're sure you'll get a lot more out of it. In due time, Alexa will send around the recording to everybody, and we'll post it. And we encourage you all to attend our group, whether you're watching this now, whether you're going to be watching it in a recording. Just go to ancan.org and you'll find out how to attend our group, 2 meetings a month. And I have learned so much about MS. I have such a better understanding of this condition than before we started working, and the group is always a joy to me. Always what gets revealed in that group, and plus it's a fun group. They always have a good laugh. Is that not true, Miss Stroh?
Yes, and we may have an official after party after the meeting. So don't want to talk, or you need to have a little smaller group, and you want the person who's punchy, stick around. And I'll be there in the group too, guys, along with some amazing people. I'm not just the only amazing one, guys. Everybody is just amazing there. So
Yeah. We may even get guest appearances on rare occasion from Carly P as well. So anyway, thank you everybody, and it's our pleasure on behalf of ANCAN to have brought this to you, and we'll see some of you in our group and some of you in our upcoming webinars. I think we have an upcoming webinar, so just plug it. I think we have an upcoming webinar in November on how to read how to help patients read medical papers, which is a really, as Dr. Strober will attest, it's a big issue.
Yes. That's great that you guys do that.
Okay, Alexa, I'll let you close this out.
Thank you everyone for coming. Have a great night.